I'm curious about what some of the common debunking style arguments that you get with an age-based strategy are, if I haven't covered any. I know that, for example, I've heard that for a young person to go out is selfish. And I've heard that for a young person to go out, particularly, I've even heard it brought up in the context of racial disparities in the United States, that, whiter young adults have a more age-based spectrum, whereas people from disadvantaged communities have more comorbidities or something like that. There's different ways of weaving the argument, but basically the premise is that it's racist.
So I think it's the very opposite for sure. I think that the general universal lockdown is the worst assault on the working class in the United States in many decades. And we know that the working class African Americans and Hispanic have a much higher proportion of their members in the working class. So they obviously also then hit disproportionately because of this. And I think that's the primary reason why they have been hit more by COVID-19. So what we're essentially doing is that with the general universal lockdown, we are protecting young college students and young professionals who can work from home, who are at very low risk, while all the working class people are out there building the herd immunity.
The burden of the herd immunity is actually placed on the people that we spend all this time talking about protecting, and and even the death statistics are the proof of that.
Correct. Yeah. So if you are concerned about those things, which I think people should be, then we should end the general universal lockdown and instead do an age-based, age-targeted approach, where we protect the elderly in all groups, both professional and working class, while we let young people go about their lives in colleges and the young professionals.
And I mean, to your point, when we're talking about young people going about their lives, working class wage worker young people have been going about their lives. They've been going about their lives for 6 months, and they're the ones building the herd immunity for the rest of us. Now, when you
and young people who go about their lives, they are not endangering other people. That's what you hear a lot in the media, but that's the opposite is true. So young people who go about their lives, take a slightly risk, but not very much. They are actually helping protect the elderly down the road by helping build the herd immunity. So they should not be chastised for going for working or for going to the beach or whatever they do. We should just be thankful that they go on and live their lives and keep the society going.